Hi, I'm Dr. Watson, here to talk to you about an important thing, and that is newborn fevers. There are a few exceptions where fevers can be emergencies. As stated earlier, fevers do not cause brain damage, but when an infant has a fever under 6 weeks old, this is considered an emergency. But it is possible they don't really have a fever, so here's what you need to do to be sure. Take a thermometer and check under their armpit. If you get the number 99, they might have a fever. But make sure they're not over-bundled in synthetic blankets. Take off their clothes and leave it down to a onesie. Wait about 10 minutes and try again under the arm. If it's still 99, get a little sleeve, put that sleeve over the thermometer, program it to say rectum, cover it with a little KY jelly, and put it about a half an inch into the baby's rectum to check the temperature for sure. If you get the number 100.4, that's 100.4, you have a fever and you need to go to the emergency room. If you have a newborn with a fever, your baby will need to have a lot of tests done and spend some time in the hospital on IV antibiotics. And that would be one example where a fever really does need to go to the hospital. If you have a chronically ill child, somebody with maybe cystic fibrosis or an immunodeficiency or cancer, or a child who possibly just had a transplant or surgery, fevers are a lot more serious. But that's not most people with fevers. Most people who have a fever get it from a common cold or something of that nature, and that's not an emergency. Remember, if you're not sure, you can call your nurse advice line with your health plan. And if you do that, you can save yourself a wasted trip to the emergency room, which means you save yourself an accidental exposure to all kinds of worse infections. Thanks for listening to my talk about newborn fevers.
In a world where disclaimers are boring, one man opts for something decidedly different. This video is intended to give you informative, educational information. It is not intended for you to self-treat or diagnose yourself or your family. Because we want you to make good medical decisions when it comes to you and your family's health. Please first talk to your doctor before trying or attempting any of the information that you have seen or heard in this video. Thank you.
If you enjoyed what you saw today, don't forget to like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.